Imagine being 80 years old, living alone in a remote village, with no income, failing eyesight, and nearest hospital over 30 kilometers away. For nearly 25 million elderly people in India living in poverty. This isn't a scenario, it's a daily reality. Today, over 12% of India's population is over the age of 60, a number expected to soar to nearly 1 in 5 by 2050. Yet, as family structures shift from joint to nuclear, many elders are being left behind, perceived more as a burden than a responsibility. But there is an organization that has been fighting this silent crisis for over 4 decades. Today, we are talking about HelpAge India. Before we proceed with the video, if you want a step-by-step guide on how to achieve financial and legal compliance for your NGO, download our free NGO compliance roadmap. It covers registration readiness, governance control, FCRA banking requirements, expenditure limits, annual filings, donor reporting, automation, and credibility standards. The guide is designed to help NGOs reduce compliance risk, improve financial transparency, and build stronger donor trust. Download the free step-by-step guide using the link in the description. Now, back to the video. So, who is HelpAge India? They are a secular non-profit organization established in 1978. It all started when philanthropist Samson Daniel approached the founder of HelpAge International for help. Instead of just giving money, they provided Daniel with fundraising training, leading to a massive sponsored walk by Delhi school children that launched a movement. Today, their mission is simple but profound: to improve the quality of life for disadvantaged older persons. They operate under the powerful motto, fighting isolation, poverty, and neglect. 8 offices and presence in over 125 districts, they have evolved from a small relief charity into a nationwide powerhouse for the elder rights. What does HelpAge actually do on the ground? They tackle elder vulnerability through 4 main pillars. First, healthcare. They operate one of Asia's largest mobile healthcare networks. These units, staffed by doctors and pharmacists, bring free medical consultation and medicines directly to the doorsteps of elders in urban slums and remote villages. They also focus on vision restoration, sponsoring thousands of cataract surgeries in base hospitals every year to restore sight and independence. Second, livelihood. HelpAge helps rural elders become self-reliant through elder self-help groups. These groups allow elders, many of them women, to pool savings and start small businesses like vegetable farming or artisanal trades. Third, aged care and safety. They operate the Government of India's national helpline, Elder Line, in several states, providing rescue support for abandoned elders and redressal for abuse. They also run model senior care homes for those with nowhere else to go. Fourth, mental health. The latest initiative, Project Sarthik, trains community health workers to identify early signs of depressions and dementia, ensuring elders get the specialized care they need. The impact of this work is massive. Every year, HelpAge India reaches approximately 2 million elderly individuals. One of their greatest milestones came in 2020 when they became the first Indian NGO to win the United Nations Population Award. This recognized 40 years of dedication to elder rights and their incredible response during the COVID-19 pandemics, where they provided relief to over 10 lakh elders and their families. But their impact goes beyond direct aid. They changed the very laws of the country. HelpAge was a key contributor to the national policy on older persons in 1999 and campaigned for the landmark Maintenance and Welfare of Parents and Senior Citizens Act of 2007. This law legally mandates that children look after their parents and establish statutory tribunals to settle claims quickly. It hasn't been an easy journey. HelpAge faces immense logistical challenges, particularly in tracking inventory for hundreds of remote projects. To solve this, they recently migrated to cloud-based tool to ensure every rupee is accounted for in real time, which is cutting operational cost by 14%. Then there are regulatory hurdles. Recent amendments to the Foreign Contribution Regulation Act, which is FCRA, have capped administrative expenses, and restricted how funds can be transferred to smaller local NGOs. HelpAge has had to pivot its entire model, scaling up its own direct delivery capacity to remain compliant while still searching for the most vulnerable. So finally, there is the societal challenge. Their research reveals that over 30% of elders face abuse in their homes itself. So often from their own children. This is changing the narrative from burden to resources in ongoing battles. I want to quickly take a minute to talk about something that make helping even easier. We have built a platform that can be a helping hand for NGOs, that is ZenDonor. Empower your NGO with ZenDonor, that streamlined, secured platform for global fundraising. Connect with donors worldwide and elevate your impact. We are offering 1 year of free access to a limited number of organizations now. Click the link in our bio to learn more. So now let's go back to our video. As our population ages, the work of HelpAge India becomes more critical every day. They aren't just giving handouts. They are building a society where growing older is met with care, respect, and inclusion. Whether it's through their hashtag Generation Together campaign or lobbying for a national long-term care framework, they are ensuring that our elders can lead active, healthy, and dignified lives. If you want to support the cause, you can visit their website to donate or volunteer. The link is right in description. Because as their brand ambassador Sharmila Tagore says, when generations come together, possibilities multiply. So thanks for watching. This is Beyond the Cause, and let's help protect those who once protected us.